Welcome to our webinar, more about menthol, regulating a toxic flavor. I'm a senior staff attorney at the Public Health Law Center and Tobacco Control Legal Consortium. We have a lot to cover today, so I'm going to keep my opening remarks brief. I'd like to start by saying that this webinar is sponsored by the Public Health Law Center's Tobacco Control Legal Consortium, our national network of legal centers and attorneys that support tobacco control policy change at the local, state, and national levels. We do this by providing free legal technical assistance to tobacco control advocates, public health professionals, local and state health departments, coalitions, governments, and private attorneys and individuals. We don't represent clients in court, and we don't lobby. Finally, our organization is committed to the principle that good public health cannot be achieved without addressing equity. I'll be moderating today's webinar and giving a brief intro to the topic. I'm delighted to introduce our presenters today. Our first speaker is Carol Magruder. Carol is a seasoned veteran of California's tobacco control experience and a founding member and co-chairperson of the African American Tobacco Control Leadership Council. The council has been at the forefront of the national movement to restrict the sale of menthol tobacco products. In 2017, the San Francisco National Association for the Advancement of Colored People honored Ms. Magruder for her community activism. And our next speaker is Dr. Todd Combs. Todd is the Assistant Director of Research at the Center for Public Health System Science at Washington University in St. Louis. He holds a PhD in political science and has experience in research, analysis, and evaluation in several areas of social and health policy. He has worked in retail tobacco policy for the last 4 years and serves as senior analyst and project manager for the Tobacco Town, Minnesota project. Okay, so here's our agenda today. We'll start with a quick overview of the U.S. landscape of menthol tobacco regulation. Then Carol Magruder will provide us with the backstory of San Francisco's historic legislation prohibiting the sale of flavored tobacco products, including menthol. And finally, Todd Combs will present findings from the Tobacco Town project, funded by Clearway, Minnesota, that uses computer simulations to examine how restrictions on menthol cigarette sales and retailer density can affect the behavior of tobacco users. We're covering a lot of information this hour, but we're hoping to have time to respond to questions at the end. So please send in your questions at any time by clicking on the Q&A button at the bottom of the Zoom window. Flavored tobacco products have been in the news a lot lately because of the incredible popularity of Juul products among kids. As we all know, the 2009 Family Smoking Prevention and Tobacco Control Act prohibited cigarettes from containing what are called characterizing flavors, including candy, fruit, and alcohol flavors that clearly appeal to young people and entice them to begin tobacco use. The elimination of flavors in cigarettes contributed to a national decline in youth use of cigarettes. However, this federal law did not apply to non-cigarette products such as these cigars and other related products such as e-cigarettes and hookah, and it also did not apply to products that contained menthol flavors. This is a little odd because menthol is the most dangerous flavor in tobacco products. For years, the FDA has had scientific evidence that menthol cigarettes, which have cooling properties that reduce the harshness of tobacco smoke, are a popular choice for first-time tobacco users. So menthol tobacco use increases youth initiation. Over half of U.S. smokers aged 12 to 17 use menthol cigarettes compared to nearly a third of older smokers. Menthol cigarettes also make smoking easier to start and harder to quit. Moreover, menthol tobacco products have a disproportionate health impact on youth and members of racial, ethnic, and LGBT communities. For example, the burden is particularly great in the African American community, as Carol will discuss in a few minutes. As you can see, menthol cigarettes are also used at disproportionately higher rates by other racial and ethnic groups as well. And an astonishing 71% of all young LGBT smokers use menthol tobacco. So you'd think by now that given the years of exhaustive scientific research that the FDA and its Tobacco Products Scientific Advisory Committee have compiled about the devastating health impact of menthol tobacco products, that we'd have figured out a way to restrict their sale in youth. use. After all, our neighbor up north figured it out a while ago. Back in April 2017, the Canadian federal government voted to prohibit the use of menthol in all cigarettes, blunt wraps, and most cigars sold in Canada. And this law took effect just October 2nd, 2017. Incidentally, this did not come about without a push from the locals. Here you can see a timeline showcasing the progress that was made since May 31st, 2015, when Nova Scotia became the first jurisdiction in the world to prohibit the sale of menthol-flavored tobacco products. Other countries also recognize the health risks of menthol tobacco. For example, in 2014, the European Union passed a tobacco products directive that includes a ban on flavorings other than cigarettes and roll your own tobacco, which took place May 20th, 2015, as well as a ban on menthol cigarettes, which takes place May 20th, 2020. Other countries, including Brazil, Ethiopia, Turkey, Uganda, Moldova, as well as Canada, have passed regulations to prohibit the sale of menthol cigarettes, as well as some or all other flavored tobacco products. And in 2016, the World Health Organization issued an advisory note unequivocally recommending banning the use of menthol and its analogs, precursors, or derivatives in cigarettes and possibly all tobacco products. Back in the US, however, we have made less progress addressing this issue. For one thing, the Food and Drug Administration does not have the authority to ban a class of tobacco products outright. Nevertheless, even though the FDA could certainly include menthol flavors in its prohibition on characterizing flavors in cigarettes and all other tobacco products, the agency has not exactly been fast out of the gate on this issue. So as a result, state and local governments are considering and actually doing what the federal government hasn't, taking measures to regulate flavored tobacco products, sometimes including menthol products, at the retail level. These measures include, for example, implementing and enforcing sales restrictions and bans and other retailer requirements, such as density restrictions. This is all, of course, assuming the local or state governments are not preempted from taking these measures and assuming the ordinances are upheld when and if they are legally challenged by the tobacco industry, retailers, or other parties. Legal challenges aren't uncommon in policies like this. For example, two cities that took a lead on passing laws that prohibited the sale of flavored tobacco, New York City and Providence, Rhode Island, were both sued by the tobacco industry and businesses. And in both cases, in 2013, the cities successfully fought off the challenges and the courts upheld the laws. Although these laws excluded menthol from their definition of flavored tobacco product, the courts ruled that the cities had the local authority to regulate the sale and distribution of tobacco products, which is significant. Carol will tell us in a few minutes about the exciting new San Francisco law that prohibits retailers from selling or distributing any flavored tobacco product, including menthol. So the story behind this law is fascinating, so please stay tuned. Here are examples of a few other local governments that have recently passed laws prohibiting retailers from selling flavored tobacco products that contain menthol, either as a constituent or additive or as a characterizing flavor. Minnesota is also moving ahead and passing laws that prohibit the sale of all flavored tobacco products, including menthol cigarettes. Minneapolis, St. Paul, and Duluth, the state's three largest cities, now have laws on the books. Of course, there are exemptions. These products can be sold in liquor stores, tobacco product shops, or licensed tobacco dealers, but they're a start. Other legislatures around the country are also considering bills to prohibit sales of flavored products, including menthol cigarettes. And finally, just this August, a group of 9 state attorneys general recommended that the FDA ban flavors, including menthol, in all tobacco products, including cigarettes, cigars, and e-cigarettes. And with that, I'll turn to Carol, who will give us more of the backstory on the historic San Francisco flavored measure.
Okay, hello, I believe I have control now. Okay, there we go. Okay, hopefully somebody give me a sign of life if they can hear me. So this is Carol Magruder, and I'm the co-chair of the African American Tobacco Control Leadership Council. And Carrie went over this a little bit, but we are 10 years old this year, and we were formed really to address some of the disparities in funding and just attention that we felt that African American people were not receiving in tobacco control. I want to give a special shout out to Dr. Valerie Yerger and Dr. Philip Gardner, who should be in this slide, this next slide here, a little lag. And so we primarily were, the three of us went all over the country and, have been working on this issue for quite some time. There they are. So those are we're the three colors, those are three musketeers, and they have been, with us. We've been working this together for these last 10 years together, crisscrossing the country. So as Carrie mentioned, and I wanted to just say a big thank you to Minnesota in general, Minneapolis, St. Paul, the Public Health Law Center, Clearway, that over these 10 years, you all have really been a beacon of equity and inclusiveness and have really helped to keep this issue alive before Chicago came on board and kind of gave us, a life support. We were on life support for a while, so now we're back in action. So San Francisco became the first city to prohibit the sale of menthol and all flavored tobacco. This was historical. We were ecstatic. And for me personally, I grew up in San Francisco and was able to talk about riding the bus out of my neighborhood where I grew up, which was Bayview, Hunters Point, to a school out in the avenues that I had voluntarily bused myself to, and riding past all of the liquor stores and the cigarette stores and out to the pristine area out in the avenues near the ocean where I went to high school for 3 years. So I really had personal experience, lived experience with watching what's happened over these past, the 40 years of this pernicious activity of the tobacco industry in our communities. So this was unanimously passed. Our Mayor Lee signed the bill, and it became law, except that the tobacco industry came in and paid for a referendum. So I'm starting at the end, and we're gonna back of how we got to San Francisco. And we called it trickle-down public health policy because many of the laws that are enacted to guard against, to ensure public health and to guard against the things that destroy public health kind of trickles down to the priority population communities. We felt that that's what had happened with menthol when our president at that time, Barack Obama, signed the Tobacco Control Act and left menthol in. So most of you know already probably that African Americans have a history with menthol. This is an abstract that we actually submitted in Singapore at the World Conference on Tobacco or Health, I think in 2012, when we were trying to figure out what we were going to do next before the buffer zones and the bans came in. So most of us know that African Americans were perniciously targeted by all major tobacco companies. There were urban programs that included the co-optation of Black leadership, heavy media campaigns, Ebony and Jet magazine were paid for with Newport cigarette advertising, free giveaways to children, the van programs. And as a result of that, 80% of African Americans smoke mentholated tobacco products. And that our youth initiate with menthol. So we also know that addiction is about science and opportunity, that when you have access to populations with addictive substances, people will become addicted to them. And so we've had an awful demonstration of that with the opioid crisis. But in my community, products have been placed there and passed around, and people have had access to our children and to their brains. And so we've had a longer history of dealing with some of these addictive substances. So for us, menthol, the issue of menthol became a human rights and an issue of social injustice. And that's how we have approached it. This young man here is the young Dave Chappelle, who many people know. He's a very famous comedian internationally. And I heard him speaking, and he is never seen without a package of cigarettes. And he's so famous that he's allowed to smoke on stage and in places where smoking is no longer allowed. And I heard him in an interview where he talked about how he started smoking. And he was given free cigarettes when he was 14 years old in Washington, D.C. at the metro station there. And he went home and said he was gonna, he told himself, I'm gonna learn how to smoke. And that's how he became a smoker. So he is only 45 years old. And is probably one of the youngest people that we know of that were victims to that pernicious tobacco industry targeting. And I'm looking for others. I'm sure he's the most famous person. And this was the woman I used to use as my poster child for what was happening with menthol and African Americans. She was given free Newports at the age of 9 in Boston public housing. She was addicted at 13, dead at 54. And her son actually successfully sued the tobacco industry and received a final judgment of $79 million. And so this woman, if she were alive, she would be my age. And I know I have a lot of people in my family that still count and depend on me, and I have quite a bit of living to do, I hope. So chemistry, as I said, addiction is about chemistry and access to people, and that's what we are aiming to stop, is the access. So as we've seen with the pernicious targeting, I just saw the rates of menthol use among African Americans just jump and double over the years until it is what we have today, which is over 80%. So at the time when our president signed our Tobacco Control Act, Newports were protected. They were left in, the menthol, but these little babies were not protected. So these are Head Start children who probably are exposed to higher levels of secondhand smoke than other kids. And so they weren't protected. And at that time, this is an inner city store in Oakland of what our children, the advertising on these stores, that constantly are a norm in our children's lives of what they see, of what people are supposed to do as they grow up. And at the time when President Obama signed the Tobacco Control Act, the Honorable Joseph Califano and Dr. Lou Sullivan actually come out and said that not including menthol as a banned substance was putting Black children on the back of the public health bus. And so he's been a champion of getting menthol off the market, and he's still alive, both of them, and are still working with us to get these products off the market. So for us, nicotine addiction is an issue of social injustice. As I said, sanctions are not designed to stop the #1 preventable cause of death, because this is political suicide. As we see, you can get something done on a local level, on a municipal level, but the further you go up, the harder it is to get something meaningful done, because there's more influence by the industry. So we want the tobacco industry to be framed as a pro-crack, pro-meth, pro-opioid force in the community. And that oftentimes African Americans and other priority populations or marginalized communities were kind of the bargaining chip in that policy negotiation. So the industry is willing to, they can give us up if they're protecting other folks. So smoking and tobacco, the control is a problem of political will. So we became a part of a national movement or international movement, really, to ban menthol. And these are just some of the people and countries that had signed on to ban it. And I'm not going to go over this again because Carrie's slide was better and she covered it very thoroughly. So Chicago led the way. We were, lamenting, meeting on the phone nationally with all of our partners. What are we going to do about this issue? And Chicago just jumped out there under the leadership of Rahm Emanuel. And the gentleman standing next to him is Bashara Shukar, who was the head of their health commission at the time. And they enacted legislation that prohibited menthol within a buffer zone around schools. So that was the first time that menthol had been included. And this is our wonderful press conference. They had media, and they enacted other things as well, which was increasing the tax, tighter controls, more enforcement. And it was a package. And they went back just recently, increasing the age to 21 last year, I think, and taxing e-cigarette use. Excuse me. So we were tired. This is the picture when we were doing all of our community engagement, and we were really tired. Dr. Valerie Yerger and I were there at that time. That was in Chicago. So you can have some fun. So Chicago's buffer zone created a buffer zone around schools. It prohibited the sale of all flavored tobacco products, including menthol, which was the first time, as I said. It was the first to include menthol, and it included Black and Mild, Swisher Sweets, blunt wrappers, and also e-cigarette juice. And so these are the products that are very popular in low-income brown and Black communities. So as I said, the buffer zone, it denormalized the inundation of these deadly tobacco products, told our children that they were important, and that they were worth fighting for, and Chicago litigated it. And so that's what other cities then were able to get in under the broad shoulders of Chicago and see that they did have the authority to do this, as this issue is relevant to inner city African Americans, to Asian and Latino communities. And it just elevated the issue of tobacco control to put the tobacco industry on notice that we weren't just gonna, we were still in the game and we weren't just gonna go down like that with that not being included. So shortly after Chicago did that, I believe Berkeley, California was the next city that created a buffer zone. And they are in the process of going back now and making theirs a citywide restriction similar to San Francisco's and Beverly Hills. So this is Berkeley makes history. The merchants come out, the retailers, and we need to be prepared for that. And so when San Francisco came on board, then of course the industry did fight back. Okay, so as we said, President Obama signed the Tobacco Control Act, and this is laying the groundwork. So in 2011, we were still hoping that the FDA would do something. We were asking cities and people and municipalities to write the FDA directly, asking them to prohibit menthol, because they were supposed to, that was one of their first charges under the Tobacco Control Act, was to do something about menthol. So we went to different cities, and so the Health Commission in San Francisco signed a resolution, as did the San Francisco Board of Supervisors. And so those were 9 non-binding resolutions, but it helped in our foundation when we went back. Who knew that we'd be going back to get a citywide restriction? But they had that in their history already, that they had been educated as the legislators, as the Health Commission, that this was an issue that they needed to do something about. And so when they could see that the FDA was not going to act, then they stepped up, as municipalities should, and they restricted the sale of these products. So then we waited a few more years, and UCSF, through their Comprehensive Cancer Center, created a program called SF-CAN that was just created to eliminate the cancer disparities in San Francisco. And of course, cancer disparities are driven by tobacco use. So this was one of the first times that they had decided, the Comprehensive Cancer Center, to really take on tobacco. And so we began to engage the community and to educate them, to educate our elected officials as well, inform and educate them. And then at the same time, parallel to that, the San Francisco Department of Public Health, which has been using the community action model as a way to educate communities and to really teach them how to advocate for themselves. And I'm a product of that community action model some 30 years ago. So I've seen how it really is a strong model that really gets people engaged for a lifetime. So we started this campaign, we educated, informed, our volunteers got involved. And so we got this bill introduced and passed in very short order. And it was pretty incredible, actually, at the time, how fast it went. I mean, we have the champion, Malia Cohen, who is now the president of the San Francisco Board of Supervisors, but she believed in it. Her grandparents had been smokers, so she had seen firsthand what happens. And she took this ball and she ran with it further than we ever dreamed of. And so this thing went through like fire. And then, of course, the industry came right in. So the day, I think, that our Mayor Ed Lee, who's deceased now, signed the law, they initiated the referendum process. They established San Francisco Let's Be Real. Their messaging for San Francisco, because this was going on in parallel cities all over the Bay Area. So each city kind of took a different take. Oakland was doing it with adult-only stores, restricting the sale. So for San Francisco, the messaging was that San Francisco is a liberal city, bans and prohibitions just don't work, adults like flavors, and the tobacco industry. So this campaign was funded almost wholly by Reynolds to the tune of $12 million. And they brought in African-American leaders to talk about that we were criminalizing the Black community, that this would increase smuggling, the Black market. It would increase officer-involved incidents with African-Americans and Latinos, and that we needed to really think about this. and they compared it to what what's happened with the war on drugs and all of the Black and brown men that were incarcerated as a result of that. So they latched on to legitimate concerns of the African American community, concerns that must be addressed by all of us, including the broader community. And they tried to basically sabotage this and to make people think that we do need to get these products off the market, but this is just not the right way to do it, by latching onto those fears. This is Reverend Al Sharpton at a church in Oakland that we were actually at. And he was saying that he wasn't taking a position, but that he wanted the community to address it and to explore it. And I agree, the African American community, they do need to discuss this, but they just don't need to discuss it when Reynolds is in the room and then Reynolds is paying for it. So this is a church in Oakland, BB Memorial, and this gentleman here was a VP of sales for Newports. So he was there quietly in the back, watching us, seeing how we were going to relate and react with each other. And it was a very interesting night. And the community members that were there were coming because they were talking about criminalization. They had mentioned cigarettes. And so they were actually angry. It was very interesting. So as I said, that the industry latches onto the legitimate concerns of our community, things that must be addressed. This is something that comes up. Eric Gardner in New York, the I Can't Breathe, the Black man who was choked to death because he was allegedly selling loose cigarettes. And the other side latches on and says it's because the taxes are so high, that's why we have the loose cigarette market, but it has really nothing to do with that. There are unfortunately, plenty of African-American men who are killed for doing nothing. The man in Baton Rouge was killed when he was selling DVDs and CDs. So it's an issue that's legitimate that needs to be resolved. This was our press conference, and this was wonderful. This is Malia Cohen there. In the middle was the chief of police for San Francisco. So she had him involved from the beginning, and we're going to be working with the police talking about enforcement because we don't want a punitive enforcement. And as we know, these laws are about retailers, they're not about users. So people can do whatever they want. No one is going to ask them what they're doing. The woman to the left there is the vice mayor of Oakland, Annie Campbell Washington, and she was the one who introduced the law in Oakland that restricted the sales to adult-only stores. So this was an all-hands-on-deck approach in San Francisco. And even though San Francisco really only has 4% African Americans, we were heavily involved in the process. With the campaigning, once we got to the broader community, we really focused on flavors and e-cigarettes because Juul, all of our children in high schools and junior high are smoking. So the messaging is important, but it's important to include menthol in any type of flavor restriction. So as I said, all hands were on deck. We want to thank Michael Bloomberg, who came in with the initial money and most of it, Tobacco Free Kids, all of the volunteers, American Heart Association, Lung Cancer, Breathe, the Truth Initiative, and then we had Larry Tramotola, who had successfully got our soda ban through. So he was familiar with the industry and all of the things that come when you go up against them. So this was the final vote that night. It was very exciting. 68% of San Franciscans said that they wanted to uphold what the Board of Supervisors had done in spite of all the money that was put in. And so it was very heartening. It was a great night. You know, in tobacco control, we have a lot of losses, so it was great to have such a great historical win. And so this is what public health policy used to be, this little drop down and ripple out to the other communities. And this is what we have created with our menthol restrictions. And so we're a tsunami for good, a public health tsunami. And that's the end of my time. And so I'm going to pass this back over to Jay.
Hello, thank you everyone for coming, and thank you to Carol for that great presentation. It was so good to hear sort of the first-hand story of the work done in San Francisco. I am Todd Combs. I am here at the Washington University in St. Louis, and I'm going to talk today about a project called Tobacco Town, Minnesota. And in this project is, as Carrie said earlier, funded by Clearway, Minnesota, and it is a collaboration from the Public Health Law Center and the Brookings Institution and us here in St. Louis at the Center for Public Health System Science. Our aims of this project, it is a 2-year project that we are wrapping up as we speak. And we wanted and succeeded in building a computational model to sort of act as a policy laboratory and simulate policy implementation for some of these menthol policies that Carol was talking about previously, and as well as some retailer density reduction strategies. And we worked with closely with those in Minnesota to help complement or to try to complement existing efforts like the recent menthol policies in Minneapolis and St. Paul and elsewhere around the state. So for the outcomes, we were mainly looking at changes to retailer density after these density or menthol sales restrictions, and then looking at the purchasing behavior of our agents or our smokers in the model before and after the menthol and density policies. And then finally, we wanted to package the results for groups like everyone here today and other stakeholders around Minnesota and the country to hopefully do a good job at explaining what we did and what we found and how you can use it in your work for policy. And so we tested 4 types of policies, and I'll talk a little bit more about what the actual model was doing in just a minute. But we tested 4 types of policies. One were restrictions on the sale of menthol cigarettes by limiting the types of stores that menthols could be sold at. Namely, we simulated restricting menthol products to tobacco specialty shops. We also tested a retailer proximity buffer that are growing. Many localities have these, but they're growing in popularity. This sort of states a minimum distance between retailers. And then we also tested geographic buffers, and these test a minimum difference between retailers and other landmarks like schools and churches and parks, like the Chicago policy. So agent-based modeling, it's a computational approach, as we've said, and it comes in really handy when we can't do natural experiments in the real world. And it helps to build the evidence base for these policies that are relatively new. That is retail-focused tobacco policies. And we start by building an artificial society of individuals, which are called agents. And we put them in an environment and using rules from the discipline of economics mostly. We create rules for how agents make purchase decisions. And then to build this model, we used empirical data from the Minnesota Adult Tobacco Survey and the National Adult Tobacco Survey. We used data from counter tools to get retailer densities in the various types of Minnesota communities. And we just always try to inform these models with as much hard data, evidence, and information as there is available. And so for Minnesota, we set out to model 6 types of towns, and those are based on the sort of population density, whether it's urban, suburban, or rural, and whether it's a higher income or lower income community. And so we used census and other data to sort of find average or typical cases of each of the 6 types of communities in Minnesota, and then we paired that with retailer densities that we got from counter tools and also with cigarette prices there. And since we were looking at these menthol policies, we also took into consideration we weighted more heavily for communities with higher proportions of African Americans to construct these typical Minnesota communities. And so here you can see a summary of on the left, tobacco retailer density. This is on the average Minnesota community, and then the pack prices on the right for regular or menthol. And we see that by a long shot, urban low-income communities have 2, 3, or 4 times the density of stores, that's retailers per square mile, that we see in any other communities. And then if you look closely, you can see that each of the low-income communities has a higher retailer density than its higher income counterpart. And except for the case of the urban retailers in the urban areas of Minnesota, we see that low-income communities also have cheaper prices for regular and menthol cigarettes from our surveillance data. And so the agents in our model had a number of different attributes. And again, these were all informed by literature and surveillance data, but we had up to 8 different agent types. And that is informing these different types of agents with different qualities based on data. And so we were looking at African Americans and LGBT persons, and then we were looking at income levels. And so combining all of those together, we had 8 different types of agents. And then on the right here are just some of what all of us know, that we have disparities in smoking rates across priority populations. And so in our model, our agents basically start out the day and travel between work and home along set routes, and they have a constant cigarettes per day or a daily smoking rate. And then based on their daily smoking rate and their income and then and how many cigarettes they have, they decide whether and where to purchase cigarettes. And I just covered a lot of that. So the decisions that our agents make, just like real people would make, is whether to buy menthol or regular cigarettes, and those are informed by menthol preferences, as we call them, from surveillance data. And then, as I said, based on that preference, income or price sensitivity, and trying to minimize the cost of acquiring cigarettes, and that's the purchase price plus the opportunity cost to buy them. And that would be the time and distance they have to travel. And so here is an actual animation of our model, and you'll see that the grids represent the towns, and the little dots moving around the grids are agents, and the other squares are retailers of different types. That's what the colors indicate. And every time something flashes yellow, an agent buys some cigarettes. And we ran the model for 3 virtual months each run, and we did 5,700 of those. We had so much data to analyze, and really more than we thought we would have. And so here are just some of the key menthol results that we saw from the model. You'll see that these charts here are separated by our 6 community types, with the lower income communities on top and the higher income communities on the bottom. And here we're looking at the percentage change in total costs. That's price and then opportunity cost for a pack of menthol cigarettes before and after implementing each one of these policies. And what becomes evident right away is that the policy on the top increases the cost by the highest percentage. And that policy is restricting menthol sales to tobacco specialty shops, coupled with a retailer to retailer proximity buffer of 2,000 feet. And we can compare that with the policies in green, the sort of the second from the bottom, and that's just the menthol restriction to tobacco shops. And we see that for just the menthol restriction to tobacco shops, it has a much higher potential impact in the higher income areas. And that's because there are fewer tobacco shops there. And But we see that in all areas except that urban low-income area with such a high retailer density, that we see greater effects of that combination policy in the lower income areas where many of our priority populations live. Another thing we measured was the average distance that smokers traveled off their regular route to buy cigarettes. And again, these are the same 4 policy scenarios that we saw on the last slide. And we see that those that drive up the distance traveled and sort of the time it takes and just the trouble and the hassle of buying cigarettes are those that increase the cost the most as well. One thing that is interesting to notice is that at baseline, that's where these arrows start to the left. We see that in urban low-income areas, smokers are traveling the shortest distance before any policies. And again, that's due to that higher retailer density. But we also see some equity effects in that with the, at least the most impactful policy at the top, the menthols to tobacco shops and the retailer buffer, we see that all smokers are traveling at least 2 miles on average to purchase menthol. And here, the same policies, we're breaking them down now by priority populations. So clockwise from the top left, we have like the general population, and then African Americans, and then low income persons, and the LGBTQ population. And here we see that, again, you know, that policy combination of restricting menthols to tobacco specialty shops and the buffer for retailers has the highest impact. It is concerning that potentially in the lower income populations is where we're seeing the least impact overall. But on average, with that policy, we saw about an 8% increase in cost versus about an 11% increase in cost for the overall population. And this, we believe, is because low-income populations are generally going farther for cheaper prices of cigarettes, and that is before any policies. And so they're seeing the least impact because they are traveling sort of the shortest additional distance once policies go into effect. And here are the same results for distance for those priority populations. And as you can see, what I was alluding to before, in the lower right-hand corner, low-income folks are traveling the farthest before any policies. And another interesting finding that we have is that African Americans are traveling the shortest distance before any policies, but then they are also seeing sort of the largest potential impacts on travel time and distance required to buy a pack of menthol after these policies. So we have a couple of key takeaways. The first one is probably obvious to most of you, but context does matter. Low-income communities, they start with more retailers and higher concentrations. And so policies affect those areas differently. And for menthol restrictions or density reductions that I didn't really talk about today, we see that low-income areas have the greatest potential impact, both community-wide and for priority populations. Low-income smokers, as I alluded to before, we saw consistently we're seeing the smallest potential impact because they were already sort of going out of their way to get the lowest price on cigarettes. Whoops. We see that these retailer policies have the most potential impact in densely populated areas like urban communities, and that restricting sales, either all tobacco products, which we tested, or menthols, which we tested and I presented today to tobacco shops, we think hold the strongest potential to impact costs and then eventually tobacco use. And as I have said a few times, the strongest combination we found was restricting sales to tobacco shops plus a buffer. And having that buffer there helps to drive up those costs a bit more. And finally, after gathering all of the data for this model for the first 8 or 9 months of the project, we realized that the only national surveillance instrument that asks about menthol in a non-binary way was the NATS, the National American Tobacco Survey, or sorry, the National Adult Tobacco Survey, and now it is no longer with us. It has been discontinued. And so what we found was that a third of all smokers are somewhere in the middle. And I have collapsed the 3 middle categories here to just sometimes. We do see that African Americans, like we've been talking about today, the biggest or a majority smoke menthol, but for all of the other groups, it's sort of a third. Well, for all of the groups, a third of them are in the middle here. And we think that that's something really important to think about while we're thinking about these menthol policies and what impacts they're going to have. And so we are combing state surveys and other surveillance instruments to see if we can find anyone parsing menthol out like this, because we found that very useful. And so I have just a couple minutes left. So I would like to show you our dashboard that is in development. We have been working on this dashboard to sort of showcase and share our results with stakeholders, and it should be released in the next week or so. We can certainly send out an announcement. You just reload it. Can certainly send out an announcement when it is. And so here you can see more about sort of, for instance, the density policies that we tested and I didn't cover today, but if we look at some of the menthol policies, we see that most of the information that I covered today is here, but this is also interactive so that you can look at just the policies that you want to look at, and then you can download the plots, do whatever, and use them however you would like. We also want to try to keep this active. This is a sort of a showcase for Minnesota policies. And we, have gathered a lot of the menthol or density-based policies that are going on in Minnesota right now, and give you a little more information about those. And then we have these links to where you can click out and get the actual policy language in case that is useful for other jurisdictions that are considering policies like this. And then we are adding resources here about menthol and flavored policies. A lot of those great resources from the Public Health Law Center, some others from our other partners, and just other good ones that we know about that would give more information on retail policy. And so I just wanted to give you a little preview of that. And like I said, we'll be making an announcement when it's totally up and free and open to the public so that everybody can use it. So thank you.
Thank you very much, Todd. Okay, before we turn to questions, we just wanted to give you the contact information for the Public Health Law Center. We have a lot of material on our website about regulating menthol tobacco products, and we'll be featuring, promoting, and linking to additional resources about Tobacco Town, Minnesota in the coming weeks. We do have time for a few questions now. So we've had a couple coming in while people have been presenting. I do have one person was wondering if Carol would have any thoughts on how to possibly use the Tobacco Town data that Todd presented on.
Right. So I saw Maggie's question, and I need some time because I'm slow to really look at it. It looks fascinating. But you know, when you're doing the webinar, you're busy working. So I need to have a moment to really look at it and go through it systematically and see how we can use it. Yes.
Okay, great. We do have a question for Todd. Todd, should suburban or rural areas worry about retailer proximity buffers, since they likely work best in urban communities?
Thanks. So we actually think that these buffers are a great policy for sustainability of other policies. So when you couple the buffers with another policy, you can sort of nip industry or retailer actions in the bud before they start. And so if you pass a great policy like restricting menthols to tobacco specialty stores and couple it with a strong buffer, then you can't, you know, in 5 years have 7 new tobacco stores open because the density buffer is there. So we think it's a great idea for sustainability for any community.
Okay, thanks, Todd. There's a question, I guess it's for me, about, you mentioned that attorneys general from 9 states recommended a flavor tobacco ban recently. Which states were they? And was able to, they're in New York, Idaho, Illinois, Maine, Massachusetts, New Mexico, Oregon, Pennsylvania, and Rhode Island. And I have another one, I guess this is for Todd. Are there any other states doing similar research studies like Tobacco Town, Minnesota?
Yeah, this is the second Tobacco Town that we've done. We sort of did a national one that we have some papers out that are linked on that dashboard and in these slides, I think. But and then we have actually a new project called Aspire that we are going to repeat Tobacco Town and keep adding to it in about 8 or 9 cities in the US. So we haven't chosen those yet. We're just starting that project, but we're excited.
Okay, great. Well, we thank you both. We only have a minute left. So again, we really want to take this opportunity to thank both Carol Magruder and Todd Combs, and to invite you all to stay tuned for more announcements about Tobacco Town, Minnesota, and to encourage you to check out our website for additional resources on policy options for regulating tobacco products, including menthol products. Thank you all again for attending our webinar.